I'm your psychiatrist today. It's nice to meet you. What brings you in?
My anxiety attacks have gotten really bad. Just bad overall.
So, I read your evaluation and I saw that you have a history of anxiety disorders. Can you describe your symptoms?
Just really bad panic attacks and mood swings and all of those bad things.
I'm sorry to hear that. I'll have you fill out these questionnaires so we can better assess how you're feeling and how we can best treat you.
I just feel nervous because I don't like taking pills and I have a lot of reservations about this.
Oh, no worries. That's completely understandable. We'll get through it together and eventually we'll find a treatment plan that works for you.
Thank you.
Welcome. So what brings you in for today's session?
My anxiety has been getting worse. I just feel vacant and surreal. I just feel like my medications aren't working. I need something else.
Don't worry, Kendra. I'll tell you this, you're not alone in this feeling. A lot of people go to a psychiatrist just to have the same resolution, but really they just have the misconception that pills will fix everything. Well, I'll tell you that there's also different treatments to really alleviate that feeling, such as holistic treatments. Such as for that, working with the pills for holistic treatments will make you feel all the difference.
Well, how do I know what is the difference? How do I know which one is going to work? How do I know that it's going to fix me?
Well, I'll help you access new perspectives and practicing techniques such as mindfulness. Then we'll go through a ton of methods to help you reduce anxiety, stress, and depression, such as that. We're not trying to really fix you with this, but simply practicing habits will just make you feel really better.
I don't know about this.
Well, I'll ask you a series of questions and get to know you better. Well, and we finish out with a meditation as well.
Okay, I'm ready to start.
Okay. If you have any more reservations about this, my colleagues and I also hold group therapy sessions.
Let me guess, your IBS is hitting again?
Yeah, my IBS has been very stressful and anxiety inducing lately.
So what's going on this time? What are your symptoms?
So every time I go out to public, I start getting stomach cramps and I get the urge to go to the bathroom immediately over my anxiety. And just the thought of getting these symptoms over and over causes the anxiety to just bring these symptoms out of me every time I'm in public. It's very frustrating.
Alright, here's your non-addictive antidepressant and anti-anxiety medication.
Is this it? Is this all I'm supposed to take, or is...
Yeah, that's everything. I'll see you again tomorrow.
Thank you.
Yeah, welcome in.
Hi, thank you.
Okay, so tell me more what's been bothering you.
So these IBS symptoms, I've been feeling very stressed, anxious, depressed, unmotivated because of these IBS symptoms. I feel like I can't even go out in public because of these symptoms. Like every time I am out, I start to get anxious because I know these symptoms are gonna come. And some of these symptoms are like I start to get stomach cramps, or I get the urge to immediately go to the bathroom. It's just, I feel like it's taking over my life. I'm starting to develop, I think, agoraphobia. I don't even want to leave the household in fear that I'm gonna be having to constantly use the bathroom when I'm out with friends or whatever. It's just very frustrating.
Man, I am so sorry you're experiencing this. I think the most primary way is to alleviate the anxiety so every time you go out, it won't be triggered as often.
So how do we go about doing this? Because I went to a psychiatrist and she gave me medication, antidepressants to be specific. And I feel like they do help at times with the anxiety, but other times I feel like they hit my stomach very heavy and it just triggers the symptoms, so I want to go a more natural route.
Yeah, I recommended he see a health psychologist because he's always about to burst.
Okay, so one thing we can focus on is relaxation training, which help you feel less tense and less aroused. Then after that, we can try also numerous techniques such as belly breathing and also journaling your thoughts to also monitor the pain that you're coming from. Then once after you do that, monitoring your pain will actually make you feel less painful over time, and with those results, I'm sure you see any results in no time and also improvements.
Yeah, it'll be hard to fit into my schedule, but I do need to try, and it's just something I need to be consistent with, but I definitely need to try that. Of course, right now I do need something to relax my mind because I'm very stressed right now.
I understand your concern. It's going to be hard work, I'll give you that, but I know you can overcome this. I will help you find healthy ways of coping and alleviating your anxiety over time. And with that, either way, I'm going to contact my team to help you support you throughout your journey.
even now, just with being here, I feel like my symptoms are starting to come on. I feel my stomach cramps. Do you have anything I can do right now to alleviate this anxiety?
Maybe we can try some relaxation techniques.
No, I
right
think
now?
I gotta go.
Hi, what brings you in today?
After my cancer diagnosis, I've been experiencing a lot of panic attacks. I have no motivation really, no appetite, can't sleep anymore. I don't want to burden my family, but I think I need help.
I hear you. I see how that you've taken SSRIs in the past. This time we'll prescribe something similar to hopefully take that edge off. And if your symptoms don't seem to get better within a few weeks, then I'll refer you to a health psychologist in combination with your medication.
That's great, thanks. I don't know, I don't feel like the medications are working. I feel more tense than ever, and it doesn't help that everybody around me is so stressed out.
What do you mean?
Like mom and dad, everyone. It seems like everyone's just gonna cry every time they see me.
Do I do that? Because if I do, that's gross. Sorry.
You do, but you're also talking to me like I'm normal most of the time, which I appreciate.
Yeah, listen, I don't know what to do about mom and dad, but, you know, if you need someone to talk to, I'm always here. Ew. Plus, there's that health psychologist. Maybe he'll help you.
Thank you. I don't think I could do this without you.
How are you, Patty?
I've been better. I've been suffering from a lot of panic attacks and depressive symptoms ever since I was diagnosed with cancer. I feel like the stress of it all is really taking a toll on my physical health. I went to see a psychiatrist a few months ago, but I feel like the medications aren't really working. My anxiety is a little bit better, but I'm still feeling very exhausted all the time, and it's hard to get out of bed.
I'm sorry that you're feeling this way. It just sounds like to your diagnosis, it seems like your stress has been elevated. And with that, what's producing your stress is that it activates your HPA axis, which thus makes your body to produce more cortisol than usual. Thus, it weakens your immune system. So that's the point of that. So with that, let's help you alleviate your pain. But right now, at the time being, I think the only way we can help you deal is by looking at your cancer treatment and assessing how you can make you feel not only physically better, but also psychologically better. But after that, then we can focus on a problem-focused coping.
Thank you. I want to do whatever I can to feel better. I'm just a little bit nervous. What's the problem-focused coping?
So that's understandable. We can take proactive steps to do whatever we can to manage your stress and anxiety to see what's the best course of action is, and moreover, then we can contact your psychiatrist and your physician to see what's the best treatment plan that also is as well. So for now, we can practice like mindfulness, self-care, and also building positive daily habits.
At this point, I'm willing to try anything.
Kendra, I'm glad that you're able to make it.
Me too.
So, how do you feel like you're coming along?
I feel great. After our last session, I went back to Dr. Casey to get more medication. And also combining your therapy with breathing and journaling has helped me for the better. I feel great.
Okay, that's good news. How about you, Patty? How have you been?
I'm doing well. I'm in remission. It looks like I'm bouncing back.
That's great news. How have your anxiety and depressive symptoms been?
Some days I'm tired, other days I'm anxious that my cancer is coming back, but being mindful has really helped. I've really enjoyed the guided meditations you recorded for me, and you were right about the food. Some of the foods I was eating were making my symptoms much worse.
Okay, that's good. How about you, Jim? I'm glad that you came here too.
I've been able to manage my anxiety, so that means my IBS symptoms have decreased a lot. I still need like a lot of work to do to be at 100%, but I no longer feel hopeless, and I'm able to leave the house now without going to the bathroom immediately. Like now, I'm able to sit here just fine.
Okay, I'm glad that you're doing better now. So let's keep managing those same techniques and those methods, and let's improve on it over time. It's been such a long day.
Yeah, it feels good to finally eat. So how's the progress with your patients?
Honestly, I've been doing good progress with them. I've been giving them treatment plans, meditation, mindfulness, other behavior intervention techniques. But it does get overwhelming. I mean, I give them these techniques, but listening to them stories and listening to their emotions, it does take a toll on me.
Yeah, I get that.
What about you, huh? What do you even do?
What do I even do? What do you mean? I just hand them pills and call it a day. I mean, it gets the bills paid.
Pills? Well, like, have you ever thought about their health? Like, are they even happy in the first place?